So good morning everyone. My name is Jelly-Ann Hoxona and today I'm going to perform the surgical hand scrubbing. So before we start, you have to put on a surgical attire such as surgical cap, mask, rubber slipper, or a shoe cover. So for surgical cap, this is to prevent the hair from contaminating sterile work area. And also for the sterile face mask, this is to prevent the escape of droplet nuclei containing microorganism. And for our shoe cover or rubber slipper, this is to protect the personnel from exposure to blood and body fluids that might contain infectious agent when spills or splashing are anticipated. Next is to examine the hand and forearms for cuts and blemishes and abrasion. So this condition increased likelihood of more microorganisms residing on them. So if you have wristwatch or jewelry, you have to remove it also because it can harbor microorganism, and the removal of jewelry allows a thorough hand washing and hand scrubbing. So after you remove your jewelries and watch, you also check and remove the nail polish or nail arts if worn. And also you also clip the nails and be sure that fingernails are short and clean and healthy, because artificial nail and nail polish increase the microbial loads on hands and interfere bacterial removal during cleansing, and long fingernails can puncture gloves, causing contamination. Then after that, once you check everything and everything is clean, you perform the pre-scrub proper hand washing technique. Then next is you perform the pre-scrub proper hand washing technique. So first is wet your hand with a liquid soap. And then you rub your hands palm to palm. With your right palm, rub the back of your left hand. And you do it on the other side. Then you interlace your finger and rub your palm together. Then interlock your finger and rub the back of them against your palm. Then enclose the right hand around your left thumb and rub as irritated. And swap hand and also do it in the other side of your hand. Then you use the ball of your finger and rub it in circular motion in your left palm. Then you repeat it on the other side of your hand. Then lastly is your wrist. And then you can get the toothpick, or I'm using an improvise to get rid of the dirt inside the nail. And after that is you properly discard it in the waste can. And then you rinse your hands properly. The next is you turn the water and adjust the temperature and applicable, so you can using a knee or a foot pedal control if it's available. And then you moisten your hands and arms using the antiseptic solution like betadine, liquid soap, or antimicrobial agent. So you extend up to 5 centimeters or 2 inches above the elbow. So first is you moisten it. So So the water drains off the elbow, flowing from the cleanest area and to the less clean area. So then after that is you remove the brush from the dispenser and then rinsing it after each nail. So using the antiseptic and microbial agents. So first use the other side. So you scrub the nail, 15 strokes each. So holding brush perpendicular, then you scrub the palm. So each side, also the thumb. So you stroke it for 10 strokes each. And then scrub it one time. The next is the arms. So you mentally divide it into 3 portions. So first here. And then is you do it in the other side. So you scrub the nail, one hand, 15 strokes each. And then you scrub the palm. And then the dorsal of your hand. And then 10 strokes each, starting from the thumb. Then the arms. So you divide it into 3 portions again. So scrubbing loosens the resident bacteria that adheres to skin surface, ensures coverage of all surface, and scrubbing is performing from cleanest area of the hand or marginal area. So after that is you dispose this properly, and then we rinse the hands and arms, keeping the hands higher than the elbow. So rinsing removes transient bacteria from cuticle, fingernail, hands, and forearms. So you make sure that you discard the brush and rinse the hands and arms thoroughly. So if you turn off the water with like using foot or knee control, enter into the room. So when you enter the room, we use we're pushing the swing door backward while maintaining the hands higher than the elbow, and then this is because the hands and the forearms held higher than the elbow and away from the surgical attire allows the water to run from the clean to the less clean area in order to prevent contamination. Slightly forward at the waist, and then you pick the sterile towel, hand towel, on the top of the gown from open package. So take note that the scrub person is the one who prepares the gown and removes the hand towel on the top of the gown from open package. So then after that, so this is how you hold it. So from the top, so dry it from the cleanest to at least clean area. And then you do it in the other side. And then you discard the towel to a linen hamper. So this is to prevent accidental contamination.